This rare disease literally has an incidence of 1 in a million. 1 in a million people may get this, and it causes extreme tightness and stiffness in someone's torso and legs, and it's characterized by severe muscle spasms which randomly occur and can be triggered by a variety of different things, including a sudden noise, light touch, and exposure to cold. On average, it takes someone 7 years to actually be properly diagnosed with this. And in the meantime, most of them are told that they're crazy. So what is this? This way for stiff person syndrome. Stiff person syndrome is an incredibly rare neurological disorder that affects the muscles and the nervous system. And ironically, early on, this was called stiff man syndrome, even though the incidence is much greater in women. So imagine you're relaxing in your home and all of a sudden you get upsetting news, or someone drops a glass and it shatters everywhere and your muscles suddenly lock up, becoming extremely stiff and making it challenging to move and causing all kinds of intensely painful muscle spasms. This is only one of a few scenarios that those suffering from SPS or stiff person syndrome endure. It's a bit like having your muscles constantly on high alert, and those with this diagnosis will have these muscle spasms out of nowhere, causing them to very frequently fall, which also leads to numerous other injuries like fractures and sprains and dislocations and lacerations and so on. So this is an extremely debilitating and challenging disease to battle. So it can manifest differently in each person, but common early symptoms include muscle stiffness and spasms, as we mentioned, exaggerated upright posture, especially in the trunk and abdomen due to the rigidity of the muscles, and then even exaggerated startle reflexes. And then as the condition progresses, people can experience shortness of breath, some chronic pain, and an exaggerated curve in the spine, and this is called hyperlordosis, and it's in the lower back, and this develops in the lower back over time due to the muscle tightness. And changes in the spine alignment can also lead to spinal cord compression, or what we call myelopathy. And then finally, there's anxiety and agoraphobia, because these spasms can happen so suddenly and out of nowhere that after a while, the risk of heading outside in an environment that isn't familiar to them is actually terrifying. So many people will wind up just saying, I'm going to stay indoors, I'm not going to go out anymore. And nowadays with grocery delivery, and you pretty much don't need to leave your house. So this becomes a real issue with these people that have this. So other less typical symptoms include eye movement problems that can cause double vision, speech issues, and lack of coordination, of course, leading to the falls that we just discussed. Now, diagnosing stiff person syndrome can be super challenging because it's so rare and its symptoms can resemble other conditions. So typically, doctors will use a combination of clinical evaluation, medical history, special testing like EMG or electromyogram, and anti-GAD65 antibodies. So we'll do blood tests to look for the anti-GAD antibodies because 80% of people with stiff person syndrome actually will have them. And we can also look for glycine receptor antibodies as well as amphiposin antibodies. Say that 3 times fast. And then ultimately we'll look at other things for non-related conditions to see if somehow this is playing a role, such as hemoglobin A1C, any vitamin deficiencies, and we can also do lumbar punctures looking for markers of the anti-GAD65 antibodies as well. And then finally, imaging studies can also be done to help visualize your brain, spinal cord, nerves, and other body structures. And usually imaging studies are performed to rule out other conditions, just like the blood test. And these imaging studies MRI, CT, etc. So again, you might have an MRI of the brain and the spine or the whole body, which is called a fluorodeoxyglucose positron emission tomography, or an FDG PET, with a computerized tomography or CT scan. So the FDG PET with a CT scan and mammogram are also done when there's concern about an underlying cancer. All right, so moving on, what causes stiff person syndrome, and are there any predictable triggers? The exact cause isn't entirely understood, but there seems to be a genetic predisposition as well as an autoimmune component, and it's also very often associated with other autoimmune conditions such as type 1 diabetes, thyroiditis, vitiligo, and anemia. Stress and infections can also trigger or worsen symptoms in some cases. So, I mean, how do you avoid stress? That's part of the issue. That's why a lot of people just don't want to head out, is because they open themselves up to an insurmountable amount of stress sometimes, and they never know when this is going to trigger an issue. So scientists don't yet understand what really causes SPS, but most people have unique antibodies in their blood that block the enzyme glutamic acid decarboxylase, or GAD. And these antibodies are called anti-GAD65 antibodies. So GAD helps make the neurotransmitter GABA. Normally, when the right amount of GABA is produced in the body, it blocks certain nerve signals. But if GABA doesn't function as expected, the nervous system becomes very excitable, hyper-excitable, which results in muscle spasms and anxiety. So the common triggers, such as being startled, are also thought to be related to the GABA pathway disruption here. So that's why sudden loud noises or crashes or anything like that can trigger one of these episodes. It's very, very interesting. Again, I know many people with this condition. It is extremely debilitating, but some of the stories that they have from their early time before they were diagnosed are extremely troubling. They were absolutely deemed as crazy or hypochondriacs or having psychosomatic issues, only to find out later that they absolutely do have stiff person syndrome. It's really a horrible cross to bear, but next, we're actually talking about what can be done for it. What can be done for this? So what can be done to treat this condition once it's diagnosed? So treatment normally aims to manage symptoms and improve the quality of life, and we'll use oral muscle relaxers such as diazepam, clonazepam, baclofen, and tizanidine. Medications that are not muscle relaxers but have some effect on the GABA neurotransmitter include gabapentin, pregabalin. Most people probably know these two best. Some will find relief also with botulinum toxin, or Botox, which is sometimes used when there are distinct areas of muscle spasms and tightness. And then there are other medications like serotonin reuptake inhibitors, or SSRIs, and these can be added to address the symptoms that are triggered by anxiety. And there's also intravenous immunosuppressant therapy, which is Rituxan. That's a common one. And then oral immunosuppressants include Imuran and then Moftil, two of the common ones. And finally, some may benefit from intravenous immunoglobulin or plasma exchange. And there are also certain medications that you should absolutely avoid if you have stiff persons. And these include serotonin norepinephrine inhibitors, such as duloxetine and venlafaxine. Tricyclic antidepressants, such as amitriptyline and nortriptyline, are also on this list. and then narcotics such as oxycodone, hydrocodone, morphine, and morphine derivatives, and any drugs that contain these substances. Alcohol can also be super dangerous, especially for people who are on medications such as Valium and clonazepam. And Valium and clonazepam are typically given to not only decrease the anxiety, but also to help with the muscle spasms. So when you combine narcotics and alcohol with this, it is a massive issue and very dangerous. Something, just something waiting to happen here. So we try and avoid them. So living with stiff person syndrome can be super challenging. I don't think I've given any other impression throughout this video, but it's also possible to maintain a fulfilling life with it. So aside from medications, other things to try include physical therapy, and anything that focuses on stretching or deep tissue myofascial techniques that help with balance or gait, and then ultrasound and heat. And this is usually pretty decent heat. Heating pads and very warm temperatures. Aquatic therapy is another one. Or TENS units. Many people with SPS will find a lot of relief with. And then there's also massage, yoga, acupuncture, acupressure, Pilates, cognitive behavioral therapy. And there's a few other treatments that I didn't mention. So these all have varying effects from person to person, but they're really worth trying. And typically a combination of medication and non-medication treatments seems to be the most effective in minimizing the severity and intensity of the symptoms over time. But it takes a while to figure out the combination that works best. So adapting your daily routines, managing stress, and seeking support from friends and family and support groups can make a significant difference. So remember, you are not alone, and there's a community of people who understand what you're going through. Now, a common question I get frequently is, will this require lifelong treatment? And the answer to this is, it very well may. Without treatment, stiff person syndrome can cause more severe symptoms such as spasms and limited mobility that just increase the risk of falls with injuries, and ultimately it reduces quality of life. And presently, stiff person syndrome treatment addresses symptoms, but again, it does not eliminate the cause. The good news is this is a condition that is being heavily researched. Many of my patients will ask whether changes to diet or lifestyle can help manage stiff persons, but the data is limited on this. Whether there's specific foods or diets that impact SPS, it's not really well understood, but healthy lifestyle choices and anti-inflammatory type diets can also help because they've shown that they helped with other autoimmune diseases. I'm a big proponent of turmeric. It is highly anti-inflammatory, and I pretty much probably put it in everything I eat now. And then also keeping mobile is very important, and it is possible when using a combination of medication and non-medication treatments. So that's another thing, and my marker's running out. Keeping mobile. Also, another side note, I cannot draw, so I decided to try doing the whiteboard today. I usually love teaching with a whiteboard, but I typically am teaching a live class. So trying to do this on camera, and I can't draw.
Okay.
We're gonna see how it does. We're gonna see how this turns out. Anyway, most of my patients are actually prescribed IVIG if they progressed to a point where managing their symptoms has become super challenging, and it can be the difference between controlling pain and spasticity and regaining function back, and further deterioration. So I review everything about this life-saving therapy in these videos here. If you or someone you know has SPS, then remember that awareness and understanding are crucial. Educate yourself, seek medical advice, and connect with the SPS community for support and guidance. So that's going to do it for now. If you found this video informative, please give it a thumbs up and subscribe. I upload every Sunday usually. And if you have any questions or you want to share your own experiences with stiff person syndrome, please leave a comment below. I love connecting with viewers and need your help spreading awareness about all of these chronic conditions. Many sufferers have messaged me, really so appreciative of shedding more light on this. And then speaking of support, if you'd like to show some love to this creator, then send a super thanks or check out our membership. It's inexpensive to join and you get access to a bunch of awesome extras that aren't available on the general public part of the channel. So with that, stay healthy and lucid.